Hello guys, this is Indian Medico, and in this video we are going to see about iris tumors. First, let us discuss about iris nevus. It is proliferation of melanocytes in superficial iris stroma. It appears as circumscribed solitary flat or variably elevated pigmented lesion. The normal iris architecture is disrupted in case of iris nevus. Diffuse nevus is seen in case of congenital ocular melanocytosis and iris nevus syndrome or Cogan-Rees syndrome. Around 8% of cases of iris nevus can undergo malignant transformation. The risk factors for malignant transformation of iris nevus include young age, inferior location, bleeding from lesion, diffuse iris involvement, feathery margins, and ectropion UVA. Now let us discuss about the management of iris nevus. We have to do lifelong observation. We have to do documentation by slit lamp examination and photography. We should also do serial fundus examination because iris nevus can be a marker for all forms of uveal melanoma. This picture shows histology of iris nevus. This picture shows multiple iris nevi. This picture shows iris nevi at pupillary margin, and this picture shows diffuse iris nevus. Now let us discuss about iris freckle. It is also known as epilis. These are superficial lesions that are smaller than a nevus with no elevation or distortion, as you can see in this picture. They show increased melanocyte pigmentation, and the number of melanocytes is normal. That is, there is no increase in the number of melanocytes. Now let us discuss about Brushfield spots. These are small whitish peripheral iris freckles arranged in a concentric ring, as you can see in this picture. They can be seen in cases of Down syndrome, or they can be a normal finding in blue eyes. They are characterized by focal mildly hyperplastic focus surrounded by a ring of hypoplasia, and they have no malignant potential. Now let us discuss about Lisch nodules. They are small well-defined nodules. This picture shows a Lisch nodule. They are seen in both eyes of virtually all patients with neurofibromatosis type 1. This picture shows extensive Lisch nodules. Now let us discuss about iris melanoma. Iris melanoma accounts for 8% of all uveal melanomas. The prognosis of iris melanoma is comparatively good. The risk factors include fair skin and lighter iris color, numerous or atypical cutaneous nevi, iris or choroidal nevus, congenital ocular and oculodermal melanocytosis, that is nevus of aorta, and uveal melanocytoma. Other risk factors include chronic sunlight exposure and arc welding. The presentation of iris melanoma is in the middle age. Histology shows diffusely infiltrating spindle cells of low-grade malignancy, as you can see in this picture. Symptoms of iris melanoma include enlargement of pre-existing nevus. Now let us discuss about the signs of iris melanoma. Pigmented nodule at least 3 mm in diameter and 1 mm thick. This picture shows iris melanoma. This picture shows a nodular iris melanoma. It usually involves the inferior half of iris. It is associated with surface blood vessels. There can be pupillary distortion and ectropion UVA. There can be localized cataract. There can occasionally be non-pigmented melanoma, as you can see in this picture. There will be slow growth with extension across iris surface. The angle and anterior ciliary body may be infiltrated. This picture shows iris melanoma with infiltration of the angle. Extrascleral extension is rare. This picture shows iris melanoma with extrascleral extension. The signs of malignant transformation include growth and development of prominent blood vessels. Now let us discuss about the complications of iris melanoma. Hyphema, cataract, and glaucoma are the various complications of iris melanoma. Now let us discuss about the investigations done for a case of iris melanoma. Ultrasound biomicroscopy can be done to rule out ciliary body involvement. Fine needle aspiration biopsy can be done, and we should do systemic investigation. Now let us discuss about the treatment of iris melanoma. We can do sector iridectomy for small tumors. Iridocyclectomy can be done for tumors invading angle. Radiotherapy with a radioactive plaque, that is brachytherapy, or external irradiation can be done with a proton beam. Enucleation should be done for diffusely growing tumors if radiotherapy is not possible. We should also monitor the patient closely for recurrence and metastasis. Now let us discuss about metastatic tumors of iris. Metastasis to iris is rare. It presents as one or more fast-growing white, pink, or yellow masses, as you can see in this picture. It can be associated with anterior uveitis and occasionally hyphema, as you can see in this picture. The tumors which can cause metastasis to iris include breast cancer, lung cancer, and melanoma of skin. Now let us discuss about miscellaneous iris tumors. First, let us discuss about juvenile xanthogranuloma. It is a rare idiopathic granulomatous disease of early childhood. In iris, it presents as localized or diffuse yellow lesion, as you can see in this picture. It can be associated with spontaneous hyphema, anterior uveitis, and glaucoma. It can also involve skin, muscle, stomach, salivary glands, and other organs. This picture shows juvenile xanthogranuloma of skin. This picture shows juvenile xanthogranuloma involving the face. Now let us discuss about leiomyoma. It is a rare benign tumor arising from smooth muscle, as you can see in this picture. Its appearance is similar to amelanotic melanoma. Now let us discuss about melanocytoma. It appears as darkly pigmented nodular mass with a mossy granular surface, as you can see in this picture. It usually involves the peripheral iris. It can undergo spontaneous necrosis, leading to seeding of iris stroma and chamber angle with elevation of intraocular pressure. Now let us discuss about vascular tumors. An example for a vascular tumor of iris is racemose hemangioma, which is basically an arteriovenous communication, as you can see in this picture. It appears as large ectatic vessel or bunch of grapes. Thank you.